September is a very important month because it's Intracranial Hypertension Awareness Month. And intracranial hypertension is a neurological condition that I was diagnosed with about a year and a half ago, but have likely lived with it for many years. And so I'm excited to answer some of your questions about intracranial hypertension and hopefully spread a little bit more awareness for it. So what is intracranial hypertension? Intracranial hypertension is a neurological condition where your cerebrospinal fluid pressure within your skull is much too high. And this condition actually used to be called Pseudotumor cerebri and is still sometimes referred to as that. And what that basically means is fake brain tumor. And so when people have brain tumors, they have an increase in intracranial pressure, which causes a lot of severe symptoms. And so intracranial hypertension often presents with similar symptoms to brain tumors without actually the brain tumor. So it's a very debilitating condition, and it's considered to be rare. It's considered to occur in about 1 out of 100,000 people, which is probably realistically a bit too low. I'm guessing it's underdiagnosed. According to research, intracranial hypertension most often occurs in women, and specifically women who are overweight or obese. But we know that that is not always the case. Intracranial hypertension occurs in women who are underweight, it occurs in men, it occurs in children, and so that is something that doctors need to be aware of. What are the symptoms of intracranial hypertension? The most common symptom of intracranial hypertension is a very severe headache. And a lot of people describe that as feeling like your head's going to explode, or a lot of pressure feeling in your head and at the base of your skull. Another common symptom is blurry vision, vision loss, double vision, tinnitus, specifically something called pulsatile tinnitus, which is when you have like a whooshing sound in your ears to your heartbeat. Other symptoms include nausea, vomiting, dizziness, vertigo. The list goes on, but those are the main ones. What part of your head do your headaches tend to be from intracranial hypertension? For me, they tend to be the worst at the base of my skull, and also often behind my eyes. And I think this is fairly common for most intracranial hypertension patients, but I think the headaches can really just be all of your head just throbbing. Are symptoms worse when laying down or upright? Typically, for people with intracranial hypertension, symptoms are worse when laying down. That's because typically when people lay down, their cerebrospinal fluid pressure builds up, and when they are upright, it tends to be a little bit lower. A lot of patients do report that any type of activity can worsen their pressure symptoms. Things like coughing, bending over, bearing down, any type of Valsalva maneuver increases your intracranial pressure and will often increase symptoms. So how is intracranial hypertension diagnosed? Unfortunately, intracranial hypertension is diagnosed with a rather invasive procedure called a spinal tap. And during the spinal tap, they take something called your opening pressure, where they measure your cerebrospinal fluid pressure through a needle that's placed into your lumbar spine. I think that's one of the reasons why intracranial hypertension is underdiagnosed, because it really can only be diagnosed through a spinal tap. And normal intracranial pressures typically range from about 5 to 18, and doctors tend to disagree on this range, and there are many ranges that you can find. To be officially diagnosed with intracranial hypertension, your pressure typically needs to be 25 or greater. When I've had my first spinal tap, my spinal fluid pressure was 34. And in people who are smaller, pressures tend to be lower, and so if you're smaller with a higher pressure, it may be affecting you more and causing you more symptoms. There are people who have severe symptoms from increased intracranial pressure, even with pressures as low as like 18. So it really just depends on the person. Another diagnostic test when assessing for intracranial hypertension is an eye exam. Many people with intracranial hypertension also have a condition called papilledema, which is swelling of the optic nerves, and that's what often causes visual issues with intracranial hypertension. Typically, doctors will also do MRIs to rule out other conditions causing the high intracranial pressure. Doctors will often do a scan called a CT venogram or an MR venogram, and those tests look at your veins to see if you have any kind of stenosis or blood clots within your brain that could be causing the high pressure as well. So what causes intracranial hypertension? Most cases of intracranial hypertension are what's called idiopathic intracranial hypertension, and that just means that they don't know what the cause is. Some known causes of intracranial hypertension are birth control medications, other medications that are linked to intracranial hypertension. Something called venous stenosis is linked to intracranial hypertension, and that's very commonly seen with it, but doctors don't know if the intracranial hypertension is causing the venous stenosis or if the venous stenosis is causing the intracranial hypertension. So it's kind of one of those chicken or the egg situations where doctors don't know which one is causing which. How do you treat intracranial hypertension? So typically the first line of treatment for intracranial hypertension is medications, which are most often diuretics. And these medications are harsh on your body. They're not a cure for intracranial hypertension, and people often don't tolerate these medications very well, and they cause a lot of side effects, especially in people like me who already have low blood pressure and low blood volume, and these pills are decreasing your blood pressure and your blood volume while they're trying to decrease your intracranial pressure as well. These medications are also not good for your kidneys and typically aren't recommended to be taken long term. For intracranial hypertension patients that are overweight, some do see results from weight loss. And this is a common thing that doctors will recommend. It doesn't work for everyone, and I definitely want to stress that. After failing conservative treatments, doctors will often recommend surgery. The most common surgery for intracranial hypertension is a VP shunt, which is a device that's implanted into your brain to drain your excess spinal fluid into your stomach or your heart. And so these shunts can definitely make a big difference in people's lives, and I've heard a lot of success stories from shunts, but I've also heard a lot of not so successful stories with shunts. Shunts have a very high failure rate. People often need many surgeries and revisions. They often cause infections and lots of other things that nobody wants to ever have to deal with. Another treatment option for intracranial hypertension that's relatively new is something called a stent for either your transverse sinus vein or sometimes even the jugular vein. And these veins take the spinal fluid out of your head, and many people with intracranial hypertension actually have what's called stenosis, which is narrowing or collapsing of those veins. Doctors have created this surgery called a stent surgery where they actually go up through your groin and your wrist to place a metal stent up in your head in the transverse sinus to open up the vein to hopefully allow better spinal fluid flow. And these surgeries have actually been very successful and have had much lower complication rates than shunts. They're less invasive and the recovery time is also less, but the downside is that they are very new treatments and somewhat controversial. Personally, I opted to have this surgery because I felt that it was less invasive than a shunt. Another downside to this is that not all patients with intracranial hypertension have this stenosis and qualify for a stent. And typically, before placing a stent, doctors will do what's called a cerebral angiogram, and this is an invasive procedure where they go up through your leg or your wrist and they go through an artery to test the pressure differentials in those different veins. Another thing to mention is that there aren't as many surgeons that specialize in these stent procedures, and so it often requires medical travel, which is not accessible to everyone and tends to be very expensive. It took me quite a long time to be diagnosed with intracranial hypertension. I've had bad headaches ever since I was a teenager, but they really started to be very debilitating about 3 years ago. About 2.5 years ago, I traveled to the Mayo Clinic, and actually my mom suggested to the doctor there that they test for a condition called intracranial hypertension, and the neurologist there actually said, no, she's too skinny to have that condition, and so they did not do an MRI and they did not do a spinal tap, and they missed it. It often takes people longer than it should to be diagnosed with intracranial hypertension. Do I have papilledema? No, I don't. And it's a misconception that you have to have papilledema to have intracranial hypertension. I've never had papilledema. I've had 5 spinal taps with really high pressure showing, and I don't have any type of vision loss, but I am really affected by intracranial hypertension. So it is important to know that it is possible to have intracranial hypertension without papilledema. And something that I've noticed that, I don't know if it's true or not, but I've noticed that a lot of my friends that have intracranial hypertension that also have a condition called Ehlers-Danlos syndrome do not have papilledema. And so I don't know if there's a connection there or not, but most of those patients are often not overweight either. So I don't know if there's a connection there or not, but it's just something that I've kind of noticed along my journey. Do I have a shunt? No, I don't have a shunt, thankfully. I had planned on getting a shunt when I failed medications, but then I found a new treatment option that I qualified for, which was the stent surgery, and so I flew to New York to have that done, and that was successful, but unfortunately I have a lot of other medical conditions that made it so it really didn't help me that much, and I recently had some major surgeries in relation to those other conditions. But as of now, no, I don't have a shunt. I might need one in the future, but I'm thankful to not have one now. A lot more research needs to be done to investigate causes of intracranial hypertension and to hopefully find a cure, or at least better treatment options than we currently have right now. If you'd like to follow along on my journey, then you can click subscribe, and I will look forward to seeing you next time. Bye guys!